Composition. The active substance is inosine pronobex, a complex containing inosine and 2-hydroxypropyldimethylammonium 4-acetaminobenzol 8 in a 1:3 molar ratio. The other ingredients are potato starch, povidone K25, magnesium stearate. Indications: supportively in people with reduced immunity in the case of recurrent upper respiratory tract infections. Action. The active substance is inosine pronobex, which has antiviral and immune-boosting effects. Dosage: adults, including the elderly, over 65 years of age. The recommended dose is 50 mg, kg body weight per day. The usual daily dose is 6 tablets, 3 grams, per day, i.e., 2 tablets 3 times a day. The maximum daily dose is 8 tablets, 4 grams, per day, i.e., 2 tablets 4 times a day. Children over 1 year. The recommended dose is 50 mg, kg body weight daily, given in several divided doses. The preparation should be used orally. The tablet should be taken with a sufficient amount of liquid, preferably water. If you have difficulty swallowing the whole tablet, you can crush and dissolve it in a small amount of liquid to make it easier to take the medicine. Duration of treatment. The usual duration of treatment is between 5 and 14 days. After the symptoms have subsided, treatment should be continued for another 1 to 2 days. Contraindications. Do not use chlorprenisin if you are allergic to inosine pronobex or any of the other ingredients of this medicine. Signs of an allergy may include rash, itching, difficulty breathing, swelling of the face, lips, throat or tongue. If you currently have a gout attack, severe joint pain with swelling and redness of the skin, or if large joints are affected by exudate, or tests have shown that you have high levels of uric acid in your blood. Additional, transient increase in blood uric acid levels, increase in liver enzymes or blood urea nitrogen, nausea with or without vomiting, abdominal pain, itchy skin rash, as the only symptom, headaches, dizziness, tiredness or feeling unwell. Arthralgia. Instructions for the use of medicine chlorprenisin. Ingredients. Active ingredient, inosine pronobex. 1 tablet contains 500 mg inosine pronobex. Inactive ingredients, potato starch, providone, magnesium stearate. Medication form, tablets. General physicochemical properties, oval tablets, white or cream color, with the middle line for splitting, 17 mm long, 7 mm wide. Pharmaceutical group, antiviral drug for systematic treatment. Pharmaceutical properties, immune stimulatory drug with antiviral action. It is a complex, containing inosine and N-dimethylamino 2-propanol in relation 1:3. The effectiveness of the complex is determined by the presence of inosine. The second component increases its availability to lymphocytes. Chlorprenisin stimulates biochemical processes in macrophages. It increases production of interleukin, strengthens the synthesis of antibodies, enhances the proliferation of T lymphocytes, T helper cells. It stimulates the chemotactic and phagocytic activity of monocytes, macrophages and polymorphonuclear cells. Chlorprenisin inhibits the replication of DNA and RNA viruses by binding with ribosome cells and changes its stereochemical structure. The drug was well tolerated. It has low toxicity. Chlorprenisin is recommended for patients with poor immunity. Pharmacokinetics. Absorption. After oral administration, the drug is well absorbed from the gastrointestinal tract and is characterized by good bioavailability. Metabolism and excretion. Rapidly metabolized. Inosine is metabolized by cycle, typical of purine nucleotides, to form uric acid level and blood serum, which can sometimes increase. It may result in crystallization of uric acid in the urinary tract. There were no drug accumulation in the body. Complete elimination of the drug and its metabolites happens during 48 hours. Clinical characteristics. Immunodeficiency, caused by viral infections in patients with normal and impaired immune systems, including disease caused by herpes simplex virus types 1 and 2. Including genital herpes and cold sores at other sites, viral respiratory infections, papillomavirus on skin, subacute sclerosing pain encephalitis, cytomegalovirus. Do not use if you have ever had an allergic reaction or hypersensitivity to this product or any of its ingredients. Drug interactions. The drug should not be used in conjunction with immune depressants, xanthine oxidase inhibitor, allopurinol, loop diuretics, taurismide, furosemide, ethacrynic acid. They increase the concentration of uric acid in the urine. Specific application. Croprenasine shall not be taken if the following applies: hypersensitivity to one of drug ingredients, urolithiasis, gout, chronic renal failure, pregnancy and lactation, children under 3 years. With extra care, medicine can be applied along with xanthine oxidase inhibitors, diuretics, and also at an acute liver failure. Usage during pregnancy or lactation. There is no sufficient research or data on adverse effects during pregnancy and lactation, therefore the drug should not be used. Usage while operating machinery or driving. There is no sufficient research or data on adverse effects during operating machinery or driving. However, side effects such as dizziness should be considered and the drug should be taken with caution. Use and dosage. The drug should be administered orally. Dose depends on the patient's weight, symptoms and conditions. Adults and children over 12 years, 50 mg per 1 kg of weight, usually 6 to 8 tablets divided into 3 to 4 doses, maximum daily dose 4 grams. Children 1 to 12 years, 50 mg per 1 kg of weight, usually 1 tablet per 10 kg for a child weighing 10 to 20 kg. If the weight is over 20 kg, adult daily dose can be given divided in 3 to 4 doses, maximum daily dose 4 grams. The tablet can be dissolved in water. Treatment duration. Acute condition. Short-term illness can be treated for 5 to 14 days. If symptoms improve, continue treatment for 1 to 2 days. Chronic conditions. Treatment may last 1 to 2 weeks after initial symptoms improve. Recurrent chronic diseases. At the beginning of treatment, the same recommendations as for acute conditions may be applied. For supportive therapy, daily dose can be reduced to 500 to 1000 milligrams, 1 to 2 tablets a day. Treatment may be repeated as needed. Children. The drug is recommended for children over 1 year old. Overdose. There are no reports of overdose. However, overdose may cause increase of uric acid in blood serum and urine. Symptomatic treatment is recommended. Side effects. In case of hypersensitivity, allergic reaction is possible. Fatigue, dizziness, headache, sometimes sleeplessness, nervousness, drowsiness, rash, itching, gout, joint pain, nausea, loss of appetite, vomiting, sometimes diarrhea. Allergic reactions. Polyuria, increase of level of concentration of uric acid in urine and blood. Shelf life. 3 years. Do not use the product after expiration date indicated on the package. Storage. Store an original package in dry place below 25 C/77 F away from tea and children. Packaging. 20 tablets per blister, 2, 10 by 2, or 5, 10 by 5, blisters per box. Manufacturer. Getty and Richter, Poland. Manufacturer's address. EU. Poniatowski Street, 5, Grodzinsk Mazowiecki 05 to 825, Poland. Distributor. Getty and Richter, Hungary. Distributor's address. Demria Street, 19 to 21, H1103, Budapest, Hungary. Are there any supplements that may be effective in boosting the immune system against COVID-19? Is there an antiviral treatment for COVID-19? Are you immune to COVID-19 after recovering from it? Can good sleep help increase our immune system during COVID-19 pandemic? Is there an antiviral treatment for COVID-19? Are masks effective in preventing COVID-19? Do antibiotics work against the coronavirus? What drugs are antivirals? Do antiviral medications kill viruses? What are the most common antiviral drugs? What is a good antiviral? How can I get rid of a virus fast? How do you fight a viral infection? Can antibiotics kill viruses?